Okay, friends, welcome back to the Pro Aging Podcast. We are in season 3. What episode are we on? Do we know?
Episode 8.
Okay, we are on episode 8, season 3 of the Pro Aging Podcast. And wherever you are here with me, and I'm happy to have you. And we're in an important episode today because I think one of the things I've noticed recently in the industry is that people are facelift crazy. Everyone is talking about this in the media. If you open up any social media page, news outlet, fashion magazine, everyone is talking about how people are getting younger and younger for facelifts. More and more people are doing them. We're seeing a lot of famous celebrities getting them done. And everyone's talking about surgery. Well, good thing we have an expert facial plastic surgeon here to talk about this. With the increasing rise of all these surgeries, we wonder, are people getting more than one facelift? Are these facelifts all good? Sometimes they need to be fixed. And because of this, I wanted to bring in a world-renowned expert, Dr. Sam Rizk, who I view as an expert facial plastic surgeon, but he is an individual that, in my opinion, does amazing work with revisional surgery, or people who have had surgery before. So I wanted to really focus on this uprise of plastic surgery, what people are doing, why they're doing it so well, and how they are getting things fixed and revised along the way. So Dr. Sam Rizk is a board-certified facial plastic and reconstructive surgery. He's also board-certified in otolaryngology, which is ENT facial plastic surgery. I think that's how people see it. And he works here in New York City. We've been working together for years. We share a lot of patients. We share a lot of things inside and outside of the office. And I am so glad to have him. Sam, thank you for being here.
I am glad to be here.
Welcome. You've done a lot of podcasts. You haven't been on mine yet?
Not yet.
Let's first talk about the increase of facelifts in general. Is this just, has there been dramatic improvements in techniques? Is it just a media sensation? Why do you think people are now so much more focused on surgery?
I think it's twofold. One, they see people in the media getting it done, looking good. That's number one, right? Social media, Instagram has basically popularized facelifts. Yeah. But also the techniques that they're seeing, the results they're seeing are natural. They're recovering quicker.
It's superior than before.
Before, much better than before. Before you had the pulled appearance, the sideways facelift. Yeah. Now we're doing more vertical deep plane facelifts. Yeah. And that is really the most sophisticated natural lift. Yeah. If you're going to go, if you have a lot of laxity, the vertical deep plane is the way to go.
It's still the way to go.
It's still the best way to go.
I think also people, they were abusing all the things that I do in my office. There was such a craze about injectables and non-invasive stuff, which of course aren't going away, but too much of a good thing. As we know, people were overdoing things, and we all realize, as I tell my patients, that there's a time for surgery. Like, there's only so much you can do up until a point. I think people are realizing this now.
There's a time for non-invasive treatments, and there's a time for surgery. I'm going to get some non-invasive treatments. I'm not going to jump into a facelift. I'm not going to. But there is a time for surgery.
Absolutely.
And you and I both know that there's a limit to what you can do in certain non-invasive modes, and then surgery, and you know that threshold.
Yeah. People still need their Botox, filler, and laser after surgery too.
I tell my patients right after the surgery, if you want the brow lift to last, you got to go get the Botox within 3 weeks, so that the muscles are not pulling the brow down.
And do you think, deep plane's been around a while, right?
Correct. But it went through a lot of modifications.
It did. And no one does it.
I just recently, I'm publishing an article in PRS to modify the entry point in the deep plane to make it last longer.
Really?
Yes.
And what is this? There's an extended deep plane. People are mixing it with other older techniques, platysmoplasties.
Yes.
I think it's very confusing.
It gets very confusing.
It gets confusing for people. And I think a lot of people say they do deep planes.
And they don't.
And they don't.
And a lot of my revisions have told me that they've had deep planes, and I go in the deep plane and there's no scar tissue.
You can tell right away, right?
Immediately.
Yeah.
The ligaments have not been released. Whether they're saying they're doing deep plane because of Instagram or social media popularity, I know some doctors are not trained in deep plane, and the patients tell me they've had a deep plane, and that doctor is not known for doing a deep plane.
Now, correct me if I'm wrong. My impression is that the original innovators of deep plane were people within the specialty of ENT facial plastic surgery. Is that correct?
There's a mix.
There's a mix. Because it seems like the people that brought it on first, or at least the surgeons I know on the Northeast, seem to come from that specialty.
There's also Sam Hamra, who is a general plastic surgeon.
Okay.
So it's a mix of different people.
It is a mix.
But the extended deep plane means that you're doing the face and the neck. So you're extending it in the neck to raise the platysmal flap to make it a continuity. Between the face and the neck. And
you're going underneath the muscle as opposed to older techniques, right? You're kind of pulling the mattress.
Correct. But the difference also is, a major difference between SMAS and deep plane is that you're keeping the skin and the muscle attached here.
Right.
So you're not going through the blood supply to the skin.
Right.
Which that is important to you.
Yeah, absolutely.
So in a way, you're preserving the nourishment to the skin. So if I grab my face and I'm pulling up and down like that, Paul, it's gliding in the deep plane.
Right.
It's not gliding under the skin.
Huh.
So we're not meant to separate that layer in the SMAS.
Are there different variations where they come from more superior, like you hear about like these terms like ponytail lifts, things like that? Is these still variations of deep plane?
These are variations of the deep plane, but they're all deep plane. And the lifts have gone from more horizontal to more vertical.
Right.
So the vector has changed.
Right. And has the downtime and risks of the procedure, because I have been, I've spoken to other surgeons that say there's a certain level of expertise because you're around certain important nerves and vessels with the deep plane, that it does take a certain level of expertise as compared to a straight platysmoplasty or something.
Absolutely. I mean, I recently demonstrated that in the Baker Gordon Symposium in a live surgery. That's the biggest live surgery conference in the US.
Yes.
I demonstrated a live performance of the deep plane. And I showed how you can stay out of trouble. But I'm a head and neck surgeon. So to me, being next to the nerve is no big deal. If you don't have that expertise in that layer, then it's okay to do a more...
And that's why I find a lot of more general plastic surgeons, at least originally, were not maybe trained in being in that space the way an ENT facial plastic was originally. Now, of course, this is becoming a lot more common. You're saying you're seeing people who say they had deep plane then did not.
Right.
What I'm worried about, and you tell me if you agree, just like with the boom of non-invasives, are we going to see a lot of,
Cavalier
cowboys. Surgeons, cowboys doing procedures? I mean, this is what happened in the derm industry. Like, Botox and filler, no big deal. Well, you have put it in the wrong hands, and we had people starting to look crazy. I'm afraid we're starting to see this.
It's interesting you say that because the deep plane is so popular. I have general plastic surgeons and facial plastic surgeons watching me. Some of them feel comfortable in the plane, some of them don't. And the ones that don't tell me, listen, I'm not going to start away doing this lift. And that's okay. You do what's safe. If you're starting out, and you don't feel comfortable, you shouldn't be doing it. Now, we do a lot of paroidectomies as head and neck surgeons. So we are dissecting the facial nerve throughout our whole training.
That's your space.
So it's a different space. I'm not doing breast implants. I'm not doing body work. That is my expertise.
I think with all the increase in volume that's going on in the country, you're going to see so many more doctors who are pseudo-trained in it or not trained at all, and they're not going to have the type of years of expertise that you and other surgeons who perform it well do. And guess what? These are patients that are going to need the topic of this podcast, revisional surgery.
So how does a consumer look at an Instagram doctor and distinguish between a real expert and a pseudo-expert? There are three things. One, did that surgeon publish peer-reviewed articles on the deep plane? Number one. Number two, is that surgeon doing live surgery to teach it to other surgeons? Three, is that surgeon going to conferences and teaching? If these three things don't exist, then it's fluff.
Oh, that's a very good, listen, that's good, people. I like that. That really gives your experience right there, because the Instagram...
Because that is non-negotiable expertise. Everything else on Instagram is negotiable.
That's right. Although he does have very good before and afters, and he'll tell you where to find them after. So listen, I always say, a procedure is popular. This is how it is in my world. A procedure is getting popular when you start seeing mess-ups in the field. You start seeing people that need being fixed. And even in our own hands, non-invasive and invasive aesthetic procedures carry risk. And I always say any doctor that says he's never seen a problem with a procedure is either doing one of two things: lying or doesn't do enough of that procedure. Complications.
Correct.
And again, people are starting to think that facelifts are like, oh, they're not a big deal. They're serious surgery.
It's serious surgery.
It's a serious surgery.
Yes, you can get an infection. It's rare, but it can happen.
Yeah.
I'm not ashamed to say that this week I had an infection.
Yeah.
It happens, right? I get probably 2 infections a year.
Yeah.
You treat it, you send it infectious disease. I can't guarantee every patient will have a perfect recovery. Yeah. But what I could guarantee is I will be there for them to give them the best outcome possible.
Yeah, absolutely. And that's the most important. The after is as much as the...
You could do a laser and you can end up, you have to know your lasers. Yeah. You can go too deep, too superficial. I mean, you can get too much pinkness. Recovery. You got to be there for them.
Yeah. Let's talk about revisions now, because you do so many of them. What are you seeing?
50% of my practice are revisions. Yeah. Of those revisions, you get the unhappy patient who dropped within a year. Doc, I've had a deep plane last year. He told me I did a deep plane. Everything is back to square one.
Yeah. Didn't last.
I paid $250,000. I'm back to square one, right? Yeah. Unhappy. Then you have a different set of more difficult revisions where they're botched. Yeah. And I don't use that term lightly. Yeah. What I mean by that is major areas of irregularities, asymmetries, stretched in the wrong direction, things being pulled incorrectly, and those are more difficult. Yeah. They've lost trust in the doctor.
They're longer surgeries, they're more complicated. I mean, there are a lot of surgeons who, and you see this in dermatology too. It's like when you get to a certain level of expertise and you want to start picking your patients as much as they pick you, and a lot of doctors just don't want to take on the complicated cases. And I've seen such amazing work with you. You're not afraid, and I think you love what you do so much. You take it as a personal challenge to find a great result for somebody.
I only do one per day, and somehow the complicated cases, they find me.
Yeah, well, that's what happens. You put out the crumbs, and the pigeons come. It's the same thing. It's true. They find you. You used to do this with noses too a lot.
I did.
In earlier days, when I first got to know you, revision noses, which I was going to mention at some point, we could mention now, because noses ain't easy, man.
Noses are the most difficult operation.
They're more difficult than facelifts, right? Yeah. And people, they look at things, it's like down to the millimeter, the size of the nostril, the everything. I mean, I've met patients who've had 5, 6, 7 revisions.
Well, that's the problem. They want symmetry. Let me be clear on your podcast. I have never done a symmetrical nose. Yeah. There is no nose that is perfectly symmetrical, because the nose is resting on an asymmetrical skeleton. Yeah. What I try to create is balance. Yeah. I feel like balance is where beauty can exist.
Yeah, it's true. And life isn't symmetrical. Some people, when they look too symmetrical, it looks like they've had work.
It looks weird.
Yeah. But people seem to get very obsessed with noses. And I mean, I have several people that have been in my chair. They come in for fillers that I tell them they're not candidates for, and they want to change the shape of their nostrils with Botox, and they want to laser stuff, and they want to put... And I'm just like, I don't see what you see sometimes. Like, your nose looks pretty good to me. Your breathing's fine. It looks pretty good. I assume there are patients that come in for noses, and you're like, I'm not doing it. I don't want to do this.
3 out of 10, I'm not doing them. Yeah. I just think that, number one, they're unrealistic. They bring in an Instagram Photoshop picture, AI, which I know if I created that, she's not going to breathe, or he's not going to breathe. Yeah, of course. So Instagram also, you got to be careful, because what you see there is not necessarily what it is. Yeah.
Have you seen, because again, I'm only in very rare cases do I like using fillers in the nose, mostly in the midline, mostly for a bump. I turn away 8 out of 10 patients for it. Have you seen issues with revisional surgery where you felt that filler was detrimental or could have been helpful? Or no, it's not like when you open up a facelift.
No, I have no problem. If you've had filler in the nose, I have no problem sucking that filler out. Yeah. Because when I get in there, I see it. Whether it's radius, I cut it out. If it's Restylane, it gets sucked.
Radius in the nose. I can't believe people do that. But I know for a fact that when you open up a face that's been overfilled over the years, not appropriately filled, not appropriately reflated, but inflated.
Inflated.
You got you know, you're scooping out a mess here.
You're scooping it out. Yeah.
You're scooping it out.
No, I prefer to scoop out Restylane and Voluma.
No, as opposed to Voluma.
As opposed to Sculptra.
Oh yeah, that's tougher.
You know?
That's why, you know, I'm not a big fan of Sculptra. I use a lot of Radius in the face. It's a little kinder, I think, on the tissue than Sculptra.
So Radius is okay because it's whitish and we see it, we know where it is, and we can cut some of it out.
Yeah.
Sculptra is like these islands of scar tissue.
It's creating scar. People are like, they love saying the word collagen. But you're building scar tissue. And scar tissue could have a benefit to the tightness and suppleness of the skin in the right amount. It certainly performs. I use Sculptra mostly on the body, but I prefer Radius because it has a filler and a biostimulatory effect. And now with everybody, I have to consider that everyone on my table, on my chair, may one day have a facelift.
So that's a good point. That's a good way to look at it. Yeah. So where do you love Sculptra? Where is it best used?
The butt.
The butt. Yeah,
cellulite. I use it for surgical defects.
I've heard that before.
I've used it a lot for surgical defects. I did 2 major revisions with Sculptra for people who had unhappy results from tummy tucks, where they had a lot of irregularities in the belly. I had someone who had a BBL and was over liposuctioned on the inner thigh, and I used Sculptra Deep and Radius on top. You know, again, because there's...
Sculptra is like for a large surface area.
Sculptra is great for deeper filling. Radius is great for superficial filling. And again, like in facelifts, so many people are getting mommy makeovers. They require revisions. And even the best body surgeons, if a patient doesn't have fat to revise the surgery, only someone like me who has the expertise in large volume filling could do it. Right. Let's get back to the faces and the revisions. And I assume that your expertise in facial revisions came from your early experience with revisions of noses originally, right? People just found it.
And doing head and neck cancer surgery. Oh yeah. Really, doing a lot of head and neck cancer at Sloan Kettering really gave me the expertise to be comfortable in areas that most surgeons will not be comfortable.
And does the vascular, like if someone has had prior surgeries or too much non-invasive things, there are greater risks to that surgery? Vascular issues?
Absolutely. I mean, for facelifts, it's not as much, but for noses, if you've had 4 or 5 nose jobs, you got to do some hyperbaric oxygen afterwards.
Do you use hyperbaric a lot for faces?
I do.
For faces, yeah. You see them a lot more of these places in the city because they're using them for longevity purposes too. But it used to be, there was only like 1 or 2. You'd have to go to like a hospital center 15 years ago.
No, there's a lot more now.
Now it's great.
It's growing, and I think it does help the healing process.
And do you...
I don't think it's like bullshit. I really think it's
real. Oh, no. I think it's helpful. Real. What other aspects of revisional surgery do you think people need to know about? Is their recovery going to be longer than their first surgery?
Recovery might be longer. Yeah. And the reason you may get more swelling under the eyes in particular. And for some reason, swelling under the eyes stays there a little bit longer. It could stay there up to 3 months.
Really?
Yeah. When we do the dissection, it tends to collect in this area more, the swelling.
Listen, I find people who've had multiple facelifts, whether they like them or not, they get a tendency to, they get surgically induced lipoatrophy. They lose preauricular fat. They sometimes have skin bound down to the muscle in the zygomatic area. And that's, you know, people, they come to me, they're like, I thought I would never have to do filler again. And unfortunately, you have to revolumize them here. Even a great facelift, 10 years later, people lose preauricular volume and they can get a resuspension of tissue.
Even after a great facelift, you need to volumize. And let me explain why. So even if I do a deep plane, if they don't have enough volume here, then you have to volumize that area, because all I'm pulling on is skin and muscle, but I want to pull the malar fat pad. If there's no malar fat pad, you're still going to have some hollowing. And what happens if you go too superficial here, you can get tethering of the muscle and a smile block.
That's exactly what I see.
So what you're talking about is a smile block. And that requires volumization between the skin and the muscle. That's like a zygomaticus major.
And when I'm doing it, and I'll use a product like Radius often, I will first use the needle to subsize the tissue because it's like bound down. And then I'll put in the biostimulatory filler, and I'll see them do little bits every few weeks to get them back to that point again.
Where you're talking about the dent when they smile right here. That depression. And that's
exactly. And people get that organically sometimes without facelift, because as we get older, particularly past the age of 45, you come too low with Botox, you're crossing over with the zygomaticus, and what happens is, and they get an indent there. And they don't realize that they keep going back to the doctor, they keep doing the same thing.
So that can result from bad Botox.
Absolutely. From coming down too low, and they just get like a It happens in men, and it happens with people with big cheekbones. And it just drops off. And what you're doing is you're purposely inducing a chronic fold here because the muscle can't contract 100%.
Interesting.
So there you go. You learn something new every day. Now, people are getting these facelifts younger and younger now.
Yeah.
And, you know, I always like to say with my procedures, it is easier to clean up your room before it gets too dirty, right? You don't want to wait till someone's 75.
Correct. But also, on the flip side of the coin, there has to be something for me to lift.
Yeah.
So I grab the cheek and I pull.
Yeah, what's your test for a patient?
This is my test.
Because, you know, after they see this, everyone's going to go at home and they're going to start going like that.
I grab this and I pull out and I pull up.
Yeah.
If I don't have 2 centimeters, which is like an inch, if I don't have 2 centimeters, I can't do a facelift.
How am I doing, guys? I think here it works.
Right? But I need 2 centimeters. How young, how old, it doesn't matter. But with all the people losing weight with peptides, you know they're having a lot more laxity now. I'm sure you're seeing a lot of patients.
They need the volume.
Face.
I always say it's the ass or the face. Their ass gets skinny, but they need volume in their face.
It's a pandemic.
Yeah, it is. And, you know, I see this in the body too. The people will come in, they'll lose weight, and they'll have all this cellulite. I'm like, you need to gain 10 pounds. You need to put some subcutaneous fat back on.
There's nothing worse than a flat cheek and a flat ass at the same time.
I know. You know, but sometimes you need to lift.
Right.
And that's where, you know, a little bit of volume and some lifting. Now, these younger patients that are getting it, that are the right candidates, my biggest concern for them surgically is that people are like, oh, well, I want to be one and done. And we know that even the best facelift ain't going to be no one and done. So we're living in a world where maybe the average age of surgery, probably, I don't know, when we were in training, maybe it was in the 60s, then it went down to the mid-50s.
Now it's like 48.
Now it's 40, right?
45 to 48.
Maybe even as early as 5 years ago, 55 was the mean, right?
55.
And when we were in training, 65, 70, right?
It's gotten younger and younger.
And now we're probably in the late 40s, particularly for the well-to-do. They're all going to need it again at 50.
Because you know what it is? They want to maintain what they have and look a little better. They don't want to wait to age and then take it backwards and then people think they did something. Yeah. So if they do it younger, you know very well that if you put a stitch in thick, strong tissue, is better than, you know, tissue paper.
Exactly.
Right? So it lasts longer. Yeah. They're doing it younger because they want to maintain what they have, look better, and it lasts longer.
Now, you're kind of ahead of the game here because you're already an expert in revisional surgery. When all these 45 and 48-year-olds are due for their second surgery, you're ready there because I think there really is an art. I mean, there are many celebrities in the media, particularly recently, they've had 1, 2, 3 facelifts already. It's, I'm sure, an enormous challenge. I know when someone comes to me, and many of my patients have been treated by other doctors, I'm working on another plane of work.
Right.
That's really it. So I'm sure, you know, there are a lot of people that come to you that thought that maybe you thought they had a great facelift, but it's been 8 to 10 years, right?
Yeah, yeah.
And then you just got to do it, and you open things up, and you see what's going on.
Doing those cases are much easier than doing the ones that are botched.
Yeah.
Doing the ones that are botched, I tell them, listen, if I give you a 50% improvement in your face, that's a home run.
That's it.
If I don't hurt you and I give you a 50% improvement, if you want to be perfect, I can't do it.
And you probably give them an 80%. I like to sell less, and then you look like a rock star.
Under promise.
Yeah, exactly. And what do you? I'm sure that's a tough question when someone comes to you and they say, "How long?" Right there. How long is this going to last, doctor?
I tell them this. If you have an identical twin and you do it and she doesn't, you will always look younger. Yeah. The effects of the facelift do never disappear. Yeah. The better question is, how good do you want to look?
How good do you
in 5 years, in 10 years? Yeah. Some people come after a good facelift, which is great, in 5 years and say, well, I just don't want to age. Yeah. I want to do it again.
And I assume there are some people that come and they're either like, oh, I still have a little bit here, or I feel like I'm redraping. I'm sure there are some people that you're like check yourself before you wreck yourself. Like, you know, you're not ready for more surgery.
The aging process starts the minute I finish the surgery. Yeah. The question is, how are you able to accept your aging process? Yeah.
This is, I mean, so many patients. I mean,
so post-op, you could send them for, you know, Althera, Thermage, you know, all these different tightening devices because they're not ready for more surgery.
Or all these things. Yeah,
no, you can't do a facelift every year.
I tell people, I said, you know, people say, oh, do you notice your business slowing down so much because everybody wants facelifts? I said, actually, it's getting busier than ever because once people see themselves look great from surgery, it makes me look good. They want more. They're like, oh, I have this, I want to 𝐒𝐿𝐴 that, or the facelift was great, but now I need filler around the mouth or CO2 laser.
Have you sent me? I told you, listen. I was sending right back to you. I told you, listen, you're going to need Botox in the neck. You're going to need some tightening devices because I can't do a facelift every year.
Yeah, exactly. It's, you know, it's like once you get thin and in good shape, you don't stop going to the gym. You don't start watching your weight.
You know what it's the mindset. These patients' mindset are sort of, you know, it's hard for them to accept the aging process. So they want to look as good as the first month after the facelift. Every other year. I can't do a facelift every year.
I think, you know, it's funny you say that because I see a lot of patients at like 1 month or 2 months, you know, they're still a little swollen.
Honeymoon period.
It's the honeymoon period. That's right. Everything's tight. They're looking good. They're taking their post-op pictures. And then at a year, their side effects are...
Deflation occurs.
Deflation occurs. But it takes to a year for the numbness, all the numbness to go away, for their full thing. It's like the side effects of the recovery are gone, but then they're like, oh, but I liked it really tight.
Because they've had a year of aging, the swelling went away, they're deflated, and that's the point where filler is appropriate now. Because I'm not going to do another facelift in a year. You've aged a year since I've done it.
What is the number, I just thought of this question, what is the most have you seen someone who's had 7 facelift surgeries for 3? Like, what's a big number?
I've seen 10.
No.
Yeah.
They've been opened up 10 times on the face?
Yep. And they actually look pretty natural.
Really?
Yeah, you would never know.
That's amazing. I mean, I would think, especially with the older techniques, people they get pulled. I mean, and this is where I really find that those patients who have the older techniques, which, by the way, were innovative at the time. The Baker facelift was super innovative at the time.
You and I both know Dan Baker did a great facelift at the time.
Yeah.
Right? But things have changed. The paradigm has changed. Patients are more savvy. They're looking for something better. They're looking for a more natural, more long-lasting lift.
There are longer procedures too, right? They take longer to do.
And I only do 1 per day. I don't want to do more than
one. No, it's a lot. And you're often doing it with, especially if they're revisional, you're doing eyes, you're doing this, you're doing that.
Lip lift, you know?
I'm finding that eyes often need to be redone, and there are limitations because some people can't, right? Because of dry eyes or fear of ectropion where it pulls down. There's some people that want their eyes done again and they just can't do it, right? There's certain, what are the limitations that some people have?
Are, one, what is your Schirmer's test for dry eye? You have to have a good Schirmer's test, which is a dry eye test. And number 2, is there excess skin? Is there fat pockets? Is there something that can be done to improve it without making the eye look unnatural or hollow?
A lot of patients that they said they went to the surgeon and they said they're not a candidate for eyes. Those are the patients that they'll get a CO2 laser resurfacing to get a little tightening and things like that. But I find a lot of people get disappointment because they get turned away for that. They don't get turned away for face revisions. They get turned away for eyes.
The thing is this, you could do a lot with the wrinkles under the eyes with laser. You can get up to 2 millimeters of tightening. And what patients don't understand is that eyelid surgery does not treat, let me repeat this, does not treat wrinkled lower eyelid skin. It treats redundant skin and fat. If you're going to look at the eye and make it look good, you have to treat 3 things. Redundant skin if it exists, fat pockets, and wrinkled skin. So wrinkled skin is not a criteria for eyelid surgery. That's a criteria for laser. And that distinction has to be made. Redundant skin and wrinkled skin, and they can overlap a little bit. Because you can treat redundant skin in the early stages with a laser.
And I will say, so many people, including myself, who's had his eyes done, you still need to put a little volume sometimes underneath there.
You do, and that's a scary part. You really have to feel comfortable doing it.
You have to be comfortable, and I know a lot. Do you use any microfat under the eyes?
I like nanofat.
Nano fat, that's what I meant. Nano fat, to put it on there just to biostimulate and whatever it takes.
It's like fat, but a smaller particle, so it doesn't clump up.
Yeah.
It gets the blood supply from the bone, and it's a whitish in color.
Yeah. Yeah.
Yeah.
We're getting some new cadaveric fat. Grafting.
So what do you think about
clay.
that?
Well, I'm getting in September. I look forward to using it because I used to do quite a bit of fat transfer because as a lipo person, and I just don't do it in the face now because of the predictability I find of the injections. And I'm like, but if you're getting surgery and you're going through the whole thing, and you are someone that needs a little volume, by all means, fat is great. I'm just not doing those.
What's the advantage of cadaveric fat? What do you see as the future?
Well, off the shelf.
Okay.
That's going to be great, something off the shelf. And my impression is that we will be able to access greater volume. Whereas with even things like Renuva, which is just like the connective tissue, the extracellular matrix, it's expensive to use large amounts. And listen, when someone needs, I have a lot of skinny, loose women that need butt volume.
Right.
There's no fat to take.
Right, I know.
You know what I mean? And I think it will be good for revisional work.
Yeah.
I think cadaveric fat will be great for revisional work. Again, all these advances are going to be great for people who are now savvy cosmetic patients because a higher percentage of the population has had non-invasive, invasive, multiple this, multiple that, which is why I think it's so essential for patients to have doctors who have a relationship like you and me and some of our close colleagues.
Let me explain something very, very important. If you want to look natural, things have to look like they belong.
Yeah.
You cannot look 40 and have 50-year-old skin.
Yeah.
That looks...
It looks crazy.
Bizarre.
Yeah. And
your skin has to match your new age from the facelift.
Yeah. I think it's a coordinated care between plastics and derm and body surgeons and facial surgeons, and I think it really is a symphony now. There's no one doctor that does it all. And I always tell patients, if you see a plastic surgeon that's spending half his time doing non-invasive things, or you see a non-invasively trained person who's doing an occasional facelift, like turn the other way. Yeah. Turn the other.
A plastic surgeon should not be doing non-invasive things.
They shouldn't. There's risks and benefits to all of it.
You went to plastic surgery because you wanted to
cut. Exactly.
Right.
Exactly. So I think it's great that people are so much more cosmetically conscious.
I think it works out for everybody.
Yeah.
For everybody, you want patients to get their best self forward.
Yeah.
Whether it's for a better job market, they want to put themselves out there. You know what I find? These older mothers now with infertility going and looking younger because they have younger kids now. They're in their 50s. They don't want to look like a grandmother. Yeah. Do you find that's true?
That's true. I mean, listen, we weren't meant to be old enough to watch ourselves age. 100 years ago, you're lucky if you had teeth at 30 or 40. Right. So let alone live long enough to, see your teeth gray and your skin sag. It wasn't a normal thing hundreds of years ago. So I think it's a psychological construct, and people are, particularly well-to-do people, are feeling more comfortable about taking care of the outside as much as the inside. So what type of advancements do you think or would you like to see moving forward? Like, what do you think the next step is? Are there regenerative medicine techniques, things to help healing?
I think one of the bigger things is stem cells, PRP, stem cells, other regenerative medicine that go along with facelifts. I think one of the biggest things that I popularized in facelift surgery is eliminating drains and using tissue glue to expedite the recovery, make it more palatable for patients.
Where are you using the glue?
I'm using it in the subcutaneous tissue in the neck to reduce bruising, to close the dead space. And that glue basically gets absorbed by the body in a week, but it replaces having a drain.
That's amazing.
And I published it in 2008, and I've done about a couple of thousand since.
I think the healing, decreasing healing decreases risk.
That's correct.
I know I've heard a lot of doctors use things like tranexamic acid now and local anesthesia to help with bruising, which is great. I use tranexamic acid a lot as well. Yeah. Again, if you can make a quicker course of recovery, you're creating a safer situation for patients, and I think that's a big deal.
And I also agree with you on that, because if you reduce swelling, you're not only reducing the recovery, you're actually giving a better outcome because less swelling means less scar tissue.
I know. I see all the patients at 1 week, and if they do have bruising, you get rid of that bruising in 24 hours with a V-beam, and all of a sudden, whoosh, things will go down. The substrates that are found in blood, which is what a bruise is, under the skin, they're inflammatory. They create problems. They not only create swelling, they create hyperpigmentation.
And that can persist for a long time.
And they create a space of where you can have a seroma if it doesn't fill in, all these type of things. So, and again, usually plastic surgeons used to say, oh, wait 6 months or a year to see about the scars. No, boom, at I removed their bruising at 1 week. At 4 weeks, I started lasering the scars, and then I see them every month. It's just amazing. I do believe, and tell me if you agree, I don't see it now because I see it's still a lot of science fiction with this regenerative medicine. I'm curious to see where internal peptides are going to help in healing. I know there's a lot of research and use of some of these new peptides like BPC in people with spinal surgery. I've had patients that have recovered from orthopedic surgery with taking peptides for a few months. We're going to see this in aesthetics, right?
That's coming. Sure.
It's coming. It's just, I'm waiting for more data.
Yes.
You know?
I don't like to be the first person to use something new.
Exactly.
I like it to be at least out for at least a year or two. Get some data on it before I use it.
I mean, even with the peptides that are FDA approved, like the weight loss peptides, they have an anti-inflammatory effect. Now, I know plastic surgeons don't use them a lot because you can't take them with anesthesia. You have to stay off of them for a while. But even in my patients who don't go under anesthesia, their recovery after if you microdose them, their recovery after surgery, it's not only helping them maintain their weight, but you're seeing the swelling go down so much just because their glucose levels are monitored.
That makes sense.
So I think the future is bright. And I think with all these advanced techniques and patients that are going to need expertise because they're getting multiple things done over the years, I think it's a bright.
We're going to see less people aging in general because of what we're doing.
I know. We'll see. Well, it's about, we want people to live better quality of life, not just quantity. And that has to do with the way you look and feel about yourself.
I mean, people are exercising more. Those are the kind of patients I get. I don't like to operate on obese people. I just won't. And neither do you.
No.
You don't.
I do not. I always say liposuction is for people with areas resistant to diet and exercise, not people resistant to diet and exercise. So, I think we covered it, man. I mean, I think it's all good. And I'm super excited you were able to join. What I want you to do is I want you to tell the audience exactly where they could find you and your expertise. So
my Instagram is Dr. Sam Rizk. My website.
Spell it.
Dr. and then Sam, S-A-M, and Rizk, R-I-Z-K. And my website, www.drsamrizk.com.
There we go, man. Well, we'll see each other in the OR. Thank you so much for joining.
Thanks for inviting me.
You're the man. Everybody, you're always getting good data here at the Pro Aging Podcast. Thank you all for joining, and we will see you next time.